Time once again to look at what's making headlines in the field of heart health. Joining me in studio today to talk about Osiris, a new stem cell therapy for heart attack patients, is cardiologist Dr. Frank McGrew. And Dr. McGrew, we're talking about stem cells. And doctor, how do these stem cells work?
Well, the stem cells move into different parts of the body, and the stem cells, by definition, are cells that have the potential to turn into any other kind of cell. In the embryonic stage, they turn into a wide variety of cells and make the whole body. In an adult, the stem cells will usually formulate adult tissue depending on the environment they move into. For example, in the heart, a stem cell placed there will usually grow into some type of heart tissue.
How are these stem cells different from the ones we hear about on the news so often?
The ones you hear about on the news, you hear about primarily because of the controversial nature of how they're acquired from embryos. The stem cells we're using in this study, however, come from adult volunteers. They come from bone marrow aspirates. And they're obtained just like you do a diagnostic study in a lab.
Are there other conditions stem cells can treat?
Yes, the most common use of stem cells is to treat malignancies of the bone marrow, where the oncologists use chemotherapy basically to wipe out all the bad cells in the bone marrow, and they have to be repopulated with new cells. So they'll give chemotherapy, wipe out the malignant cells, infuse new cells to repopulate it. That's the most common use. We use them to try to grow new heart tissue, but they're also used for other things like Parkinson's disease, even lung disease, and there are some immunologic disorders of children where they're used a lot.
How does the patient receive the stem cells?
Well, that's one of the nice things about this particular trial. They get them through an intravenous infusion just like they get an IV of sugar or blood or any other thing, through a peripheral vein.
And who's eligible to be in this study?
Well, in this trial, there's a fairly narrow window of patients who've had a heart attack within the preceding 7 days. They have to have a heart attack that's fairly severe, not a light one, because we want to see a patient who has enough heart muscle weakness so they have a chance to get better. Somebody with a small heart attack would have just a small amount of potential improvement. But a large heart attack has big potential. The reason for the 7-day time frame is that the heart sends out signals to the body that basically says, I need stem cells, I need help. So when the stem cells enter the bloodstream through our infusion, they'll migrate into the heart, set up processes there, become engrafted, and do beneficial things to lower inflammation and to hopefully grow new heart tissue.
And so that's how they help a weak heart?
Well, they probably help in several different ways. They probably reduce damage to the heart from the heart attack per se because of the chemicals they carry in them. They also tend to reduce inflammation that surrounds the heart attack. And then lastly, we think they'll actually turn into heart cells and to grow new heart tissue that has been damaged by the heart attack.
Well, this is fascinating. Thank you so very much, Dr. Frank McGrew of Baptist Memorial Hospital.